check and obtain authorization, assemble my supplies. Good morning, Mrs. Jones. I'm Amari. Today I'll be your CNA, and today I'll be feeding you. Is that okay with you? Okay. I'm going to close the door, wash my hands, put on gloves, and I'm going to make sure that I provide the patient with oral hygiene. Ms. Jones, do you need to use the bedpan before we start? No? Okay. Making sure that she's positioned in an upright sitting position. And then we wash and clean her hands and face before getting started. And I want to make sure that the overbed table is cleared off and I only have my necessary items on there. Next, I'm going to check the tray, making sure that the name card is on there. It is. The correct diet is there, which it is. Making sure all of the food is present. And making sure that if I need to substitute or remove anything, I do it right after I check. Okay? Now I'm going to place the tray on the overbed table. Put a towel or a napkin under the patient's chin. And begin feeding the patient. But first I want to make sure that I cut any meat, butter any bread, open any cartons that need to be open, and that the food is arranged conveniently. Making sure that I feed the patient a little spoonful, holding it at a right angle, using the tip of the utensil. Okay. Here you go, Ms. Jones. Sip of the beverage. Making sure that each liquid has a separate straw. Making sure that I let the patient know what they're eating. These are some Cheerios. Okay. Making sure that I let the patient know what they are eating, allowing the patient time to chew, making sure that I'm checking that the patient is swallowing. Okay. Making sure that I alternate between solids and liquids. Here's a sip of water. All right. Checking to make sure that she's swallowing, allowing enough time to chew. Next, I'm going to allow the patient I'm going to wipe their mouth properly and frequently. Allow them to wash hands and face when we're finished. Remove this. And we want to allow them to wash their hands and face when we are finished. And provide oral hygiene once again. Okay. And then I'm going to make sure that I check for the patient is in correct body alignment. The bed is at its lowest level. The side rail is elevated. And that the call signal is in reach of the patient. I want to make sure that I record the amount that the patient ate and record the liquids if the patient is on an I&O record. Then after that, I'm going to clean and replace my equipment, remove gloves, wash hands, and record and report required information.